Joining us now, Mary Mayhew. She's the president and CEO of the Florida Hospital Association. Thanks for giving us some time on, I think, a story that's kind of been underplayed in the country in terms of the massive reach of this, what it says about cybersecurity, and it's putting people's health and healthcare at risk. So how are patients and medical staffers coping with the ongoing challenges here?
Well, I think it's a very good point. This is a national concern. Imagine if we were talking about an attack on the country's electrical grid, or if we were talking about an attack on aviation control towers. We are talking about the country's healthcare infrastructure, and it's not if it's going to happen, it's when. As you just pointed out, the country's largest health insurance company was successfully attacked, and it was associated with a foreign criminal, cyber criminal, seeking not only access to the information, but ransomware, getting paid millions of dollars. We are obviously concerned at how vulnerable our healthcare system is. Hospitals are working constantly to increase the dedication and the resources to cybersecurity, but they are being bombarded daily with these types of attacks. And of course, it isn't just the ransomware. It's not just getting access to healthcare information, as you pointed out. It is shutting down healthcare systems.
You oversee hospitals that were also impacted by the first major outage a few months back. So what long-term consequences are you still dealing with as a result?
And again, what hospitals are experiencing, although you cited one of the more recent attacks on hospitals, it's the dependency on third-party vendors. Change Healthcare, the largest, one of the largest claims clearinghouses used in Florida. We had over 100 hospitals, 100% dependent on this claims clearinghouse, successfully attacked by this foreign cyber criminal. It led to hospitals being unable to submit claims, which again, it sounds administrative, but it meant they weren't getting paid. If hospitals aren't getting paid, they're unable to make payroll, really crippling a number of hospitals, particularly smaller hospitals. This has been front and center for hospitals. As I said, though, for years, we are seeing a significant increase in cyber attacks on healthcare, on hospitals, and on their third-party vendors. So a lot of focus on all of the various tabletop exercises, the kind of security training that needs to occur with all employees. But we all see it day in and day out. I don't know how many times a week I get letters from companies saying your data may have been breached. We've got to be careful that we don't become desensitized by this and recognize it for the threat that it is, especially to our healthcare infrastructure. And I would put it into the category of a national security concern.
So often that sometimes I think, oh, this may just be a scam, like wanting me to click on a link. And that's not always the case, obviously. But in a time of scams, in a time of data breaches, you know.
You don't know which is which.
Yeah,
I got one last week. I forget who it was from. I was like, really? Another one?
Again? Yeah.
And that's what's scary, because I'll be honest with you, and obviously we do the news for a living. But I gotta be honest, it seems like the hackers just keep winning. I mean, they've gotten into everything. It's been military, it's been federal government, private businesses, this hospital disaster. It just seems, and granted, I'm sure our intelligence groups stop a lot more and stuff that gets through, that makes the news. I fully understand that, so it gives a slanted view of things to some extent. But how would you, as the nation as a whole, how are we doing on this front? Because these hackers just always seem a step ahead in some way, and it's only going to get worse, because one day it is going to be the water or the electrical system or the nuclear facility, something that really halts our transit. It's going to be something major.
It is alarming, and we can't forget that. The risks, the vulnerabilities that we have are great, and the magnitude, the volume of cyber criminals from the low end to the most sophisticated. So the volume that we're contending with, the amount of resources that are being dedicated to this. But just imagine an organization like a hospital where, we are dealing with turnover. These are difficult jobs. We've got new nurses, new staff arriving every single day. The amount of the vigilance that needs to occur in training staff. And as you just pointed out, these are not complex schemes that are resulting in the successful hacks. It's somebody giving away their credentials, their password. It's somebody picking up a USB drive in the parking lot and inserting it into their computer. It's not having the two-factor multifactorial security, which is what happened to United Health Insurance. So we have to be vigilant, but we've got to also, for hospitals, we've got to be prepared for what does it mean to revert back to manual operations, because we have to sustain continuous healthcare operations. And I will say, in Florida, given the risks we deal with hurricanes, we're prepared to sustain operations. It doesn't mean that we are not constantly focused on ways to guard against. It does feel like whack-a-mole. We address an area here and it pops up elsewhere.
Whack-a-mole.
Yeah.
That's exactly it.
All right, President and CEO of the Florida Hospital Association, Mary Mayhew, thank you so much for your time. We appreciate your insight.
Thank you for having me.